tear, it falls and hits the ground. A tree, it falls without a sound. A bird, it calls and sends you home. A man, he sits in the cold all alone.
Hi, Gabby. Welcome to the Joy of Sunflowers. Thank you so much for joining me. Please introduce yourself a little bit more.
Thank you for having me. So I'm Gabby. I am a group practice owner. I'm a therapist by trade. And I am also an infertility warrior, a pregnancy after loss mama. And I am here today to just share messages of hope, I hope, and resilience.
Yeah, beautiful. I've got to say, a lot of us haven't seen a therapist necessarily, but we need to. We've been thinking
Yes,
about
I
it.
know. I know. I don't treat any infertility or like pregnancy after loss issues. I actually treat eating disorders, so totally different realm and specialty. But infertility is just so close to my heart, and I was really hoping to, share today.
Beautiful, beautiful. Yeah, we all have some realm of eating issues. I know I
Stuff. Yeah.
can't help but eat sugar at the moment. I'm addicted to trying to
That
eat.
is okay. All food is good. All food is good.
Great. Well, let's get stuck into the beginning. So,
Yeah.
did you always know you wanted to be a mom, or was it something that you sort of came to?
Yes. So one thing I left out is that I'm married and I have a wonderful husband named Andrew. And I share that because on our first, maybe second, but I don't think I held back on the first date when he was like, oh, like I'm pretty sure he asked me like, what's your dream job? Or like, what do you hope to do? Because at the time I was working partially in private practice, but partially in community mental health and still developing in my career. And I was like, well, I hope one day to own my own practice, which I do. But I remember saying to him, my ultimate dream job is to just be a mom. And so I've always wanted to be a mom from like as young as I could remember.
Beautiful. Yeah. I'm the same.
Cool.
So you start, so it's just even when you're really young, you're just like, yeah.
Yeah. You kind of know. I think it's totally okay not to know, and there's like nothing wrong with that at all. But I can say for me, for as far back as I can remember, I've always wanted to be a mom.
Yeah, yeah. So where did you go from there? So you met your husband. Um, when did you sort of start the conversation of, right, yes, we're going to start trying now?
Yeah. So I mean, I didn't scare him off on that first or second date, so that was good. And I think he very much also had the feeling of always wanting to be a dad. Obviously, both of us not in those moments, but like that was definitely for sure, part of our life plan. And then we got engaged in 2018. We got married in the spring of 2019. So we beat the pandemic, thank goodness, because if we would have gotten married a year later, it would have been disastrous. So I'm very glad and thankful for the timing of our relationship for sure. Um, and prior to us getting married, we had kind of decided like we wanted to try right away for kids. I was turning 30. I'm now 34. So it was kind of like, not that that should matter, but they tell you it does. So we took that into consideration. We also, again, really wanted children. There was no question about it. So kind of as soon as we got married, we kind of started trying right away. And unfortunately, we were not successful on our own and had to ultimately do IVF, but that took a while to get there. So we tried on our own probably for about 6 months, and then my husband had some like health things happen, and then the pandemic hit. We're like about a year later, and so we were kind of like on pause. And then that following summer, I would say July of 2020, we started like, I don't want to even say casually trying because nothing feels casual about trying when you go through infertility, but like casually trying again. And we, he was in a much better place and we were in a place to continue trying. And then from July of 2021 to June of 2021, it was kind of just like nothing, like no luck at all. I had reached out to my primary care and she's like, well, you've already technically tried for more than a year because we had that like 6 months period prior. And she was like, let me run some tests. But she was like, I'm not really sure what it could be. So she ran some basic tests. Again, this is my primary care physician. She's wonderful and lovely, but not an RE. So she ran some, everything came back normal. She had Andrew get a test run, totally fine. And so on her end, she was like, I'm stumped, but that's okay that I'm stumped. And according to me, you should be able to get pregnant. So I don't know, but let's get you to a specialist. So she was really good about kind of holding my hand through that, because anyone who's been through infertility knows like that's not an easy process. So then she was with Penn. So she got me hooked up with Penn, but Penn was on a waiting list for 6 months. So this was like late June, early July. And they said, yeah, we can see you. We can see you in December. I know. I know. I remember like hanging up, like I take the appointment, right? Because I'm desperate. I don't know where else to go because I've been with this doctor for a really long time. I'm devastated because I'm like, oh my God, I can't imagine waiting another 6 months right now. Obviously, of course, we could have kept trying, but it wasn't working. So it just felt like, what the heck? So anyway, so then Andrew and I actually looked into adoption really briefly because I was just like, well, if this isn't going to work anyway, I was very defeated at that point already. But unfortunately, the adoption process is not easy. I don't know that it should be easy, but I don't think it should be as hard as it was. So after doing some research and some conversating and all those things, we decided that just wasn't for us right now, although a very valuable and beautiful option for people who go that route. It just wasn't for us, at least in that moment. We kind of put it in our back pocket of like, if we exhaust everything else, this is here. And we'll jump through all their hoops of fire. So then that brings us to like July. Both of us are born in July. So I think I'm turning 33 at this point, which to give you context, we're starting when I'm like 30, 31. So yeah, was like, wow, that feels so weird to think about it. Cause like this July I'll be 35. So it just feels like so strange. But anyway, so I had reached out to I did some research. I found a few fertility clinics that were local to us. I got some information from people. We did some initial appointments, kind of just like test them out. I will say no one set us on fire. There was even someone that like we really did not like. Ironically, we ended up at that clinic, but with a different doctor. But I'll get there in a minute. So we tested out some clinics just with like the intro conversations with the doctors. Of course, it's so overwhelming. It's so costly. It's so much poking and prodding and it's so many things, right? So we did that. Then when I kind of came up short towards the end of the month, I was just like, what are we doing? Like, this is so hard. So, the story I love to tell is when we were driving to Maryland to see my husband's friends for his birthday, because his birthday's at the end of July. And one of his friends who was with us shared that a couple who we were friendly with was pregnant. And as a fellow, I know, IVF warrior, I know of the punch in the gut. No, this friend had no idea what we were going through. He's like a wonderful, wonderful human. And how could I be mad? I also was like happy for them, but just like devastated. Truly, I felt devastated. Like that's like the best word I can think of. I felt devastated for us. So I messaged a friend of mine. At the time, we were more like colleagues. Now she's like one of my best friends, Colleen, and she kind of shared with me her journey. And she ended up at Shady Grove Fertility with a doctor named Dr. Callan, which is who I ultimately also ended up with, who I just love, and forever am so grateful to him and my nurse Amber, who is like an angel. Literally, she's the fertility nurses. If you're a fertility nurse and you're listening to this, like, you are sent from heaven. Like, you're amazing. But she was just so great and we clicked so well. But anyway, so I go to lunch with Colleen probably in like early August. She had spoken so highly of this person. Maybe it was like mid-August, but she had spoken so highly of this person. I reached out and made an appointment 3 weeks out, which, okay, that I can handle, right? Like, that's appropriate for a specialist. And at that point, we had kind of already looked into Shady Grove and were like on the fence, but just how beautifully and kindly she shared her story with me and spoke about him. I just really had a good feeling. Met him. We had a great like initial meeting. He seemed very confident that he could get me pregnant, which I would say he's the first person that made me believe like it was going to happen. Maybe not in that moment. And he was very clear, like, this is not going to be an overnight process. He would definitely say, like, there might be times where you're mad at me. Like, this isn't easy. But he was like, I do believe that, like, we'll get you a baby. Like, he really just had such conviction where I was like, I don't know. But okay. And he was probably one of the like first people to give me hope, to be honest. That wasn't like an intimate person in my life, like a professional. So that really meant a lot. So we moved forward with Shady Grove. I did, oh gosh, 3 IUIs to get started. So of course, you know, he sent us for a bunch of tests as they do. And he's like, come back when these are done and we'll get things going. So we got on it like right away. So I'll say like the middle to end of September, we were meeting with him for a follow-up. We probably met with him like the beginning of September. So we were not wasting time. We meet with him and he basically was like, yeah, I don't know why you're not getting pregnant. And he's like, but I do feel just as confident as I felt when I met you. And he kind of said, when you have unexplained infertility, which is what we have, sometimes you find out answers as you go through the treatment process. We did not, which sucks. It's okay. It is what it is, right? It's frustrating, but we got to the end goal eventually. So we had unexplained infertility. He kind of laid our options out there. He really didn't recommend timed intercourse. He really also didn't recommend an IUI, but wasn't opposed to it, and kind of had said, like, at this point, your fastest way to a baby. He never said only, he never said won't. Like, he was so great about being like, this is all the options. But he said, your fastest way to a baby is IVF. And he did explain IVF and the intensity of it. And he didn't mince his words. He definitely is like a straight shooter. So Andrew and I kind of took the weekend. I talked with my friend. I talked with Andrew, obviously. That's my husband. And we decided, let's do 1 IUI. And if that fails, we'll go to IVF. Because that just felt like, let's give it a try. I don't know. I'm sure other people have felt that too. We went back to him. He was totally on board with that. He was like, absolutely. The least invasive intervention is always the best. And if this works, great. He was definitely upfront about our odds. Like, it's about 10% of a chance, but 10% was better than 2%, which is what we were at if we did it on our own. So he was on board. We did it. Unfortunately, at our clinic, they close in December and they stop accepting people for IVF around the end of October, which is how, like, when all was said and done and we were through our first cycle, which failed, that was where we ended up. So that was really hard and disappointing. We did 2 more IUIs because they basically were like, we can just put you on pause and call you in the new year, which would have been fine, but I kind of felt like I wanted to stay on everyone's radar. They also did say that by the 3rd time, it can go up to like a 15% chance. So I was like, well, 15's better than 10. So I did it. You know, it still wasn't great, but 15 was much better than 2. So it felt valuable, although it was kind of hard, especially I think after the first one not working, I don't think super phased me. I was disappointed. The second one not working, I felt like the wind got knocked out of me. I was so just like, really. And of course, it's right around the holidays. Anyone listening and who's been through infertility during the holidays, it's awful. That heartbreak, that ache for a baby, it's so real. I'm sorry that you have to live it. And I hate that I lived it, but we're strong and, we know how to get through things. So, get through the holidays. In the new year, we go in, we have a plan. Him and I meet right before Christmas. And he's kind of like, I know what happened. I know these didn't work, but let's just move forward with IVF. Like, I have a plan. I have your protocol. Like, we'll start first thing. You just have to get your insurance verified. Now, I definitely should have led with this. I am privileged to have had some insurance coverage. Even with insurance coverage, IVF is expensive. It is a true privilege, although a very challenging privilege, to do what, we had to do to get our baby. So, January comes, we're good. Have my pre-auth that I didn't need, and we get started. So we do one round of an antagonist cycle. I'm sure, again, most IVF people know what that means, but that's basically just the type of drugs that were used during our IVF cycle. We stimmed for we did like 12 days, which I think the average is like 10, but we did like 12. I was responding fine, but I think he wanted to kind of get the most out of what we had. I had 19 follicles, but again, for everyone listening, we know every follicle does not produce an egg. So I go in for my egg retrieval. This is probably the beginning of February. Was it? Yeah. Around the beginning of February, 2022. I was like, let's see. February of 2022. And we get 9 eggs. So to wake up from a procedure, going in at 19, again, no, I think I, in my mind, had a number of like low teens, acknowledging that like not every follicle would produce an egg. Wake up, I have 9. So, I'm like, oh, what? I honestly cried. I was I just felt so defeated. And I was like, what? Now, again, the nurses, it wasn't my nurse that was there that day, but it was one of the amazing nurses on the surgery side. And they were just like, that's okay. Like, that's still a really good number. And I'm like, I don't know about that. And I will say my doctor was incredibly kind. He came over, he checked on me. He said, your body did what it could do. It did good. Like, he was very affirming, which again, he is like not this warm and fuzzy guy. So I think he just had like a soft spot because I think he just knew my desperation. I really do. So anyway, fast forward, we know what happens next. There's the rate of attrition. I was lucky that 8 of the 9 were mature. So that's a good start with egg-wise. So we had quality, not quantity. So that was good. 4 fertilized, 3 made it to blast. All of these, although they sound like they're really diminishing, and I think most people know these aren't awful numbers. And then 2 were genetically normal, which is good. Now, I really went into IVF wanting a girl. Both were girls. So that was even more just like, oh my God. So we were happy. That made us feel good. And even though it wasn't the shebang that we were hoping for with a bunch of embryos, 2 wasn't a bad place to be. So we were able to move forward to our next step, which was the transfer part, because the way my clinic broke it down, or at least my nurse did for me, which was so helpful, is that there's like stages to IVF. And like the first stage is the egg retrieval stage. After the egg retrieval stage, granted, you have embryos to use, then you go to the transfer stage. And she's like, and it's okay if you don't get there because we will get you there, or, if that's what you want. But so I made it through stage 1 in my mind, and we didn't come out empty-handed. Although, again, I had wished I came out with more, but that was okay. And we came out with 2 girls. So I was like, whoa, this is not awful. So then next, we transfer. So we prepared for transfer. Prep for transfer can look different for everyone. There's modified, there's natural. I did a medicated cycle. There was kind of no reason not to. I hadn't really responded badly to any of the other medications. It was my first round. So they were like, let's do what we typically do, and we can always change it up later. I was fine with that. It wasn't fun, but it was all right. So fast forward March 17th of 2022, I transferred my daughter. I did become pregnant, but unfortunately on April 10th, I miscarried. So that was really hard. All that work, all that lead up, all that money, time, and it's my right? Like it's my daughter. All of those things aside, at the end of the day, for me, my daughter passed away. So that was really hard. I miscarried in a public place. So that was really, really challenging. I was with my niece. She knows what happened, but like in the moment, I tried to make it as least scary as possible, but she's not dumb. And, when she finds out the next day that we miscarried, she put two and two together. So that was really hard. But, it was really just such a bad day. Even thinking about it as the day comes up soon, I'm like, oh, what a bad day. It was just such a bad day. I basically bled for hours, but I never bled through a pad in an hour. So they never told me to go to the ER. It was a Sunday. So they were kind of like, we'll just see you tomorrow, which I was like, okay. Now, my doctor wasn't on. My doctor was actually on medical leave at the time. And I still think if he would have been there, probably would have brought me in. I don't think I would have had a different outcome. So that happened. It was really awful. I went in the next day. They were, of course, more than caring and compassionate. But, when someone looks to check to see if your baby's still there and your baby's not there, it's devastating. So that was really, really hard. So we did that. Then post miscarriage, I had never been pregnant before, like I think I said, and I've also never had a miscarriage. So I had no idea how to navigate or what to expect. Luckily, I have some of the greatest friends in the world and also friends who have been through it. So they were just amazing. They just really rallied around me and supported me and answered my weird, gross questions because I did not know what was going on or what to do. And for me, I bled a lot, like truthfully, more than I had ever bled in my life. So I was kind of scared. And I will say my clinic was communicative. Like they kind of just kept telling me it was normal. But I was like, nothing feels normal about this. Like, this isn't normal. And they were like, no, like this is pregnancy loss. And I was just like, okay. So I kind of had to take their word for it. It took me a little while to get my period back. I will say my doctor actually ended up calling me maybe 3 days after it happened. Now he was on medical leave. And what had happened was like I was bleeding pretty heavy and I wanted to see a doctor. Like I was like, I understand that I'm no longer pregnant, but I want to understand what's coming next. And it was a really bad time of year. It was like right before Easter. So like everybody was unavailable or they were booked and I'm no more important than anyone else, but I felt that I needed to talk to a doctor. So my husband, I will say, really stepped in and basically was like, you will get my wife an appointment. And he's not that way. He's probably like one of the most like cool, calm and collected, relaxed guys. So it was so nice to just, have someone in my corner because I'm normally the assertive one, but I just didn't have it in me. But he really stepped up big time. So what ended up happening was because the person they were going to be able to get me in with, it was like maybe the next day or 2 days later, was kind of like under my doctor. He had to sign off on it. So I think he saw what happened and then he called me and he talked and he let me cry and he kind of explained it because when you transfer a euploid or normal embryo, I think I felt like I'm bulletproof. I wasn't. And no one said it to me like that, but I think it just gave me this false sense of security, especially after seeing her in there. And I should back up. I did go through like beta hell. If anyone's been in beta hell, my first beta was like 23, but then it was like 200. So it was like, oh, okay. And then it did double and then it didn't double. So I was in all of that. So it was just such a stressful time. But anyway, after you see it and you're like, okay, it's in the right place because they did check to see if it was ectopic or anything like that. You're like, I'm good. This is good. She was measuring a little behind, but it was nothing that they were like overly worried about. It was more just like, we just need to keep seeing the HCG rise. We need to just continue to make sure that she's growing and all the things. And then before we could even check again, I had lost her. So anyway, my doctor calls me, kind of explains that like, although PGTA testing is great and a huge advancement, although like I beg to differ, but okay, a huge advancement in the fertility world, it's not bulletproof. And it's not perfect. And they don't always get it right. So he was pretty convinced it was the embryo. We really had no reason to think it would be anything else at that point. I had kind of asked him, like, let's run every test. And he was like, why don't we talk about this in like a couple weeks when I get back? And he's like, that'll give you time because your HCG has to go back to 0 and all the things. Now, my HCG did cooperate for the most part. It took a little while to go back down, but it definitely took a while for my cycle to come back, which was just so strange because as much as like I didn't want my cycle, I did want my cycle so that we could move forward. Now, what was nice is because we had another embryo, we could have just went into transfer, but we chose to do another retrieval because I just felt like there was so much weight on this one embryo. And I just didn't have this like emotional bandwidth for this not to work and then to be at 0. Like that just felt so emotionally heavy. In hindsight, it could have worked. I still don't know. We have yet to transfer that embryo, but so anyway, so this is like mid-May of 2022. My cycle comes back. My doctor comes back. Also, my amazing nurse who was on leave as well comes back. So I'm like, okay, I have my team. And as much as I don't want to do this, I'm going to do it anyway because I want a baby so much more. My husband was super supportive. He was kind of like, I'll do whatever you want. Like he kind of knew like at that point, it was like, well, you're the one who has to do it. So like the end of the day, this is up to you, but I'm here either way and I support either decision. He was very, very, and is very, very supportive. So my doctor comes back, we talk all our options. He's kind of said, if you want to do a retrieval, I support that. He was like, we're going to double all your doses. We're going to get as many eggs as possible. Like we're going to be aggressive. He was like, if you want to transfer, I also support that, but we need to take the next steps and make sure your uterus is clear. So we moved forward with retrieval. So this time around, we still did an antagonist protocol because it's not that it didn't work, just he thought I needed more of it. He was right because we doubled pretty much everything and I ended up with 44 follicles. I was at risk for OHSS and I did have mild OHSS, but mild compared to like what it could be. But oh, yeah, that was so uncomfortable. Anyone who has done this before, that 44 follicles does not feel good. But so we had 44 follicles. Not all of them were mature follicles, of course. Some of them were kind of small, some of them were in the middle, some of them were bigger. We ended up with 25 eggs, which is a really good start, a really good place to be. 17 were mature, 11 fertilized, 6 made it to blastocyst, and 4 were PGT normal, 2 were girls. So now I have 3 girls. They can throw the boys away. I don't care. I'm totally joking. Totally joking. But yeah, so now I have 3 girls in my corner and I'm like, wow, that feels like so much better. And what was great was that basically as soon as we got the PGT results, we were already basically prepping for transfer as if it was going to happen. Unfortunately, what happened for me is that when they went in to do the saline sonogram, which is basically where they just go in and make sure everything's cleared out in there, because after loss, it isn't always. They found some polyps and some tissue that was like residual from the loss, which was really hard for me. I don't know why in particularly, but that just felt so devastating. Not that like we couldn't move forward, because I knew it wasn't like a big deal, but just that there was still something there, acknowledging that it wasn't my daughter, acknowledging that it was kind of remnants of it, was just so hard and so difficult for me to process and sit with. And it just almost brought up the feelings of loss all over again. So we had to schedule a hysteroscopy, but what my team did allow me to do was keep moving forward with transfer with hopes that everything would be normal. And they're like, if it's not, this will get canceled. And they were very transparent about it, but they also, again, I think knew that I was just like, come on already, especially after having like a really difficult retreat. I don't want to say it was like difficult, but it was like, I mean, again, just having 44 follicles, it was just a lot. It was like way different than when I had 19 and then 9. Like, it was just, I felt so physically awful. It sucked, but we got through it. So I think they knew I was just ready to move forward to the next step. So they did keep my transfer kind of tentative, but they were like, let's do this first. Let's see, make sure everything's normal. And then they use the word pristine, which I think is so funny to describe a uterus as pristine. Isn't that so funny? I like had to share that because I will never forget them being like, your uterus is in pristine condition for a transfer. And I was like, okay, you know, whatever you say, but that.
Yeah, it's like when they tell you, you know, you have a wonderful looking uterus, and you're just
Yeah.
like,
Yeah.
Why? Why are you saying that?
What does that mean? Like, I know, it was so funny. I will just never forget that conversation. I'm being like, huh? But okay, you know, great. So the polyps, everything that was there all came back like normal, benign. There was no traces of endometriosis, which was kind of something they had like floated around, but my doctor was not quick. One thing I really, really appreciate and loved about my doctor was he was not one to speculate, and he wasn't quick to like make a diagnosis. He was like, he really wanted to be sure, which like I just felt so calmed by and relieved by. So we're in like July, if everyone's keeping up with my timeline. So that was the very beginning of July, I think right after the 4th of July. And then everything came back pretty quickly, that everything was normal. So we were able to move forward with transfer. Transfer was scheduled for the 28th of July. My birthday is the 21st and my husband's birthday is the 31st. So it was just funny how it kind of fell right in the middle. And then on the 28th, we did transfer after doing, again, another medicated cycle because it seemed to work. My lining thickened, the embryo stuck, it just didn't stay. So we were like, yeah, we'll do it again. So you guys know I was definitely doing the progesterone in all the places and all the things, and it wasn't fun, but it worked. And we did become pregnant. I was not in beta hell this time. My first beta was like over 1,000. So that was great. That was so amazing. My second one was also pretty high. It was over 2. So it doubled, which was just like, oh, I don't even know what this is. Like a doubling beta, like this is great. So that felt really good. But it was terrifying. From the moment I found out I was pregnant, I was thrilled and terrified. And still now at 38 and a half weeks pregnant, I am thrilled and I'm terrified. So the last 9 months have not been super fun, but I will say I'm incredibly grateful to be able to say, you know, I'm hoping to have a live birth soon and to have someone to call me mom. I know that I am a mom and my daughter is in heaven, but I can't wait to hear that word one day, you know?
Yeah. And I'm sure I'm not the only one who's rooting for you right now.
Thank you. Thank you.
Yeah, look, pregnancy loss, you know, is insane, but being pregnant after is also extremely, extremely difficult. I know a lot of women, you know, go through this, you know, infertility journey, and they're just like, you know, I just wish I was pregnant. I just want to be pregnant.
No.
Which is I can understand that. But yeah, once you've been pregnant and then you lose and then you're pregnant again, it is terrifying. It is actually
Yeah.
terrifying. I'm also pregnant and I'm
Yay.
29 weeks today.
Exciting.
And I feel you. I'm with you in all of the emotions, the fear, the anxiety, everything. Um,
Yeah.
it is hard. It's you know, you've got all these hopes and dreams just like normal, like you know,
Yeah.
you would normally, but then you're like every time you go in for a scan, you're like, well, I don't know if I'm gonna meet this one. So they look
Yeah.
great. But
Today. Yeah.
yeah. You know, and then, you know, when you enter this space, you hear so many stories, and then you're just like, well, literally anything could happen. Like,
Yeah.
I don't feel
Yeah.
any better. Like,
No. No, 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 not at all. I think
but
there's like a piece of gratitude, right, that
yeah.
comes with it, but there's just still so much anxiety and fear.
Oh yeah. Yeah. And I think you know, and there comes guilt as well, because you're like, shouldn't I just be glad that I'm pregnant? Shouldn't I just feel, you know? So we
Yeah.
have all the same emotions that we were having, like with our losses, with going through infertility, you know, that whole thing of, you know, oh, I need to do something better. I need to be a little bit better at this. Or, you know, it's funny how we all like have very similar thoughts in terms of like
Mm-hmm.
the guilt and how we sort of process what we're going
Yeah.
through. But the truth is, we're doing our best.
Mm-hmm.
And pregnancy after loss is hard. And we're allowed to be fearful. We're
Yeah.
allowed to feel anxiety, because the last time we went through this, it didn't pan out the way we wanted it to. And that's
Yeah.
okay. For me, I've just been like holding on to hope and going through all these interviews and speaking to all these women. I've learned so much. Like I've grown so much, and I'm so, so grateful to everyone who I've spoken to, because it's really helped me to move through this season and be okay. I don't know if you've had something similar. Is there something that has really like pulled you through this kind of season of pregnancy after loss, and just sort of being, it's okay, you know?
Yeah. Yeah. I think first just like owning the sadness, the grief, because I don't know about you, but I've definitely experienced a lot of heavy, heavy grief, especially as I've gotten closer to the end. I think part of it is like that the anniversary of what happened is coming up. So that plays into it. Going through the holidays was really, really hard. But I think instead of beating myself up for it and being like, you just need to be grateful, although I am grateful, I'm sure you can totally say the same. I'm devastated that my other daughter isn't here. She would have been born in December, I was happy to be pregnant in December and devastated that I wasn't giving birth. So it was just very, you know, dialectic in a sense of the joy and the grief. So I think letting myself feel the grief, not beating myself up for the grief. Also, again, I have the best friends. Like I really do just have the greatest friends. Unfortunately, most of us have been touched by either infertility or loss in some way. So just having them affirm for me that what I was feeling was okay, and kind of just being there to listen and support and also distract, right? Like I can't tell you how many coffee dates and brunch dates and dinner dates they've taken me on. So they're just great. And having a supportive partner. I think my husband, I think it's different, obviously, for men when we experience loss, especially early loss, because, you know, I'm not going to say he was not connected to our daughter, Hannah. That was her name. But I think it was really different for him because it happened in my body. So I think it was hard. It was hard for him to make sense of it. But I think, he just listened. He would just say, like, he would try to make things better in the beginning, but I would say that doesn't help me right now. I don't need you to be cute and funny, or, I just need you to be with me in this mess. And then eventually, he kind of just listened. And I think also started to let his own self come to grips with it, which I think was really hard for him. I think in his mind, he was like, but we're pregnant now. Like, let's focus on that happy, joyful piece of it, which, yes, I'm here for that. But I also want to focus on the fact that we lost a baby and that we should have a baby right now. And I know that that's messy and uncomfortable. And maybe it's the therapist in me that wants to talk about it, but he was really able to learn to just listen. And I think start processing his own healing in that. So that was really great to be able to do that together in our own separate ways.
Yeah. No, I completely resonate. My husband was the same. He didn't really feel it. So he knew he didn't feel it. He said, look, I'm sorry, I don't really feel the loss because, there was nothing, and it's understandable. Early loss, you don't necessarily see a baby. You don't necessarily, feel anything. Obviously, as a man, you're not going to feel anything. So he was just not connected at all. In that sense. So for him, yeah, he just wanted to he wanted me to like be okay,
Yeah.
So yeah, we had a similar thing, and I did talk to him, and I just said, look, this is how you can be there for me, because he'd said a few things that were not helpful.
They don't mean it.
I'm sure your husband said the same thing. So
yes.
Things, like some of it you just like, mate.
Yeah.
Like, what even possessed you? And then I looked up an article that said like what not to say, and then I got him to read it, and he was like, oh, I said like most of these, and I'm like, yeah.
That's amazing. Yep, I'm sure Andrew could say the same.
So good. And then they're just like, oh, okay, my bad, it's a real thing, I'm sorry.
That's so funny. I love that.
Men are great,
they're great. Sometimes.
Well, doing this, like, there are men who do feel it, who really go through it and really, experience that loss, and they'll experience it with their partner. So, not all guys are the same, and some guys really do experience it. So, for those ladies who their husbands didn't experience it, we're here. I get it. I'm with you.
Yeah.
But for those whose husbands did, there's plenty of you guys out there as well. So that there's like a whole crazy mix of just people who experienced and didn't, and said things and shouldn't have said things.
No. Oh, I know. I think that's one thing too. Not even we'll take the husbands out of the hot seat for a second, but just in general, the things people say. And I know often it's so well intended. But at least you can get pregnant is not helpful. I can admit that there was a moment that I did feel relief personally that I was able to, because until that point in my life, I had never been pregnant. But you pointing that out doesn't help me because I just lost a baby. Exactly. Right? Yeah. Or people saying things like, and my husband works at a church, he's a worship leader, and saying, well, it was God's plan. So God has lots of plans and God is amazing. And I understand that this is part of my story, but I don't really think God took away my baby. God creates life and he loves life. So let's just not say that. Yeah. Let's just not say, even if you think it, right? Even if you personally believe that, do not say that to someone who lost a baby now, ever. The end. I could think of so many more, but those were the two biggest ones I think I heard. And I was just like, I'm going to die.
Yeah, like, I'm Christian and I hear this and I'm just like, shut up. Like, that is not what you say. And I was like, yeah, and like, how can you even say, oh, it's God's plan when you have no idea? And you could be, I mean, personally, I'm with you. Like, I don't think that God does that because he's all good. And so I see it as, you know, God makes good of the bad things that happen. Bad things happen because we live in a fallen world, and that's it.
Yes.
So
Yes.
that's how I see it, right? So when someone
All
says
the things,
I'm like, one, it doesn't make any sense that he would like that's something God does. And two, like, I don't understand how you think that's gonna help someone feel better. You know, like
no, I know. And I think that's also where Christian to Christian, we get like a really bad rap, right?
Yeah.
Like when we say these dumb things and we start to say like, oh, well, that was God. Was it? Like, and also like, you know, I didn't know that he called you up on your cell phone and you guys had a one-to-one conversation and told you about my personal life. I didn't know that. So we just have to be mindful because that can really turn people off to God. And like you said, God is all good and so loving and all powerful, sure, but he loves us and he only wants what's best for us. And yeah. So anyone who wants to say that, please bite your tongue. You can believe it all you want, but just bite your tongue, please.
And like, don't say, oh, God needed another angel in heaven. God, you know, just don't say anything.
Don't say it. Yes.
All right.
Don't do it.
Yeah. We're Christian. Okay. And we're saying it. Just don't say it. Okay. Do not speak about.
Take our word for it.
Yeah. Yeah. I think, you know, we're told to spread the gospel, you know, and
totally.
the amazing news of Jesus. And I think that's what people need to focus on. Okay. Don't make claims for God. Okay. Do not claim
he's got it covered.
Yeah.
He's got it covered.
In your own life, you could be like, oh wow, I really feel like God did that. You know, that's fine. Just don't speak about someone else's life and be like, yeah, God did that. Unless it's like a thing, you know, because I've spoken to a couple of women who they're literally walking, talking miracles. I'm like, I feel like God saved you.
Yes.
And they too. So they were like, yes, I feel that too. So it was just like a beautiful conversation. But it's not like I was like, oh yeah, and I feel like God put you in that horrible position that you were in. No, because that's just not the case. And also, I'm not going to speak on God's behalf like that.
Right. I do not have that authority. I am just not that great.
But yeah. So yes, people, please think about what you're saying and whether it's actually going to be helpful, because that's really not.
Yeah, totally.
But yeah, no, it's so amazing. And you know, you get confused because like sometimes it's people who are so lovely and they're so like loving, and then they say something and you're like, why?
I do think a lot of it is like you don't know what you don't know. And like I remember some of my friends going through their losses and prior to me going through IVF or prior to me having lost, and just being like, I couldn't imagine, you know. And again, being a therapist, I probably have more of a mindful way of just hopefully speaking in general. But I just remember being like, I couldn't imagine. And I remember thinking to myself, like, I wouldn't know how to come back from that. Like, and just being in so awe of that person and also so saddened for them, but just in awe of them and their strength. And then it did happen to me. And I know for certain I could have never imagined. So I think if you don't know, you really don't know, but then just be quiet. I'm praying for you. I love you. What do you need, right? How can I support you? Ask. We'll tell you. Right? But don't say stupid things, please.
Don't say stupid things. That is like, that should be a hashtag. Don't say.
Yeah. Please.
For the lost community. Hashtag. Tell everyone this.
Yes.
Oh, well, I mean, if we'll move aside from terrible.
Yes, we'll get off our soapbox.
What's the best thing that someone said to you, like the most helpful thing that really kind of like maybe helped you heal in a sense and helped you move forward? Is there anything that someone might have said or done?
Yeah. I think I don't know that there was like one particular thing, but I think just like, again, my friends just continuing to show up for me. And my husband too, I guess I'll lump him in that. He's a friend, but like really, they just kept showing up and nothing was too much. And I think my friend Colleen, actually, in the very beginning of my fertility process, like prior to, any loss or anything, was just like, it's okay to put yourself first. Like, she was like, you're allowed to say no. And I'm sure you hear this all the time. You're allowed to say no to the baby shower. You're allowed to say, I want to support you, but this is something I can't talk about with you right now, or whatever it looked like. And, as friends, we want to show up for our friends and celebrate our friends, but it's okay if you have to step away. It's okay if you have to say, I love you. I'm here for you, but I can't talk about your pregnancy right now because that's hard for me. That doesn't make you a bad friend. That doesn't make you unsupportive. That makes you human. So I think just like her almost unconditional permission to be like a little selfish and to just own my shit was like really, really, really helpful. But all of my friends over and over again just continue to show up. And I think since being pregnant, just their availability to like answer questions. Like one of my friend's husbands is a doctor and she was like, literally text me anytime. He's not an OBGYN, but he's a surgeon. So like he knows things. So just their ability to just keep showing up. And I think allowing me to be all of us to be imperfect, but my imperfect, messy self was really helpful.
Yeah. No, I love the way you kept like, you were like, and my husband. But the thing with our friends, like they don't have to be there, like at all. They don't live with us. They don't have to like come over. They don't have to do all those things. So when they do,
Right.
it is amazing and it is wonderful because our husbands are kind of stuck with us. They live with us.
Yeah.
And they can either make it slightly easier or they can make it worse. And it's their decision.
Yes. Totally.
Oh, they can let you cry and be there, or they can be like, aren't you over it yet? And then
I know.
you're gonna get different reactions.
For sure. Totally. No. So I always say this as like a therapist, I say this a lot, like there's really a lot of healing in community. And I think having a support system when you're going through infertility and when you're going through loss and pregnancy after loss is just so powerful. And I really think that that's a big piece of what got me through.
Yeah, definitely. And so many women say the same thing, like community really just help them move forward. And it's that validation, I think, that really kind of pushes that journey through loss, through the stages of grief, that actually helps us to move forward and get to that acceptance phase and get to that point where we're like, okay, I can keep going. I'm okay now.
Yes.
I mean, obviously we're not over it because there is no
Yeah. I'm definitely not. No, I will say one thing I forgot about. I can't believe I didn't even shout her out yet. I saw a miscarriage doula, which I think was so powerful. Obviously, as a therapist, I am pro therapy. I did go to therapy for a little while to try to navigate this. Unfortunately, the person I had connected with, although she was a great therapist, she did not have lived experience. And I think that lived experience is just so invaluable. So we only connected for a short time, but I am grateful for the time her and I had together. But after my loss, I got connected with a miscarriage doula. Her name is Arden. Her Instagram is the miscarriage doula. She's just amazing. And I think we would meet like once a month. I think now we meet probably every like 2 months, but just having someone to grieve with me, it just was so powerful. So I'd also say if therapy is not your thing, that's okay. When it comes to pregnancy loss, there is no right or any loss. There is no right or wrong way to heal, but there all are alternatives. And I think grief and loss doulas are so powerful.
Yeah, no, they are. I've spoken to a few of them, and there is a difference in the way that they approach the conversation a lot of the time as well, like because they have that full understanding. And yeah, I mean, I actually just put into to become one. And
How cool. You'll be awesome at that.
I was like, I'm talking to all these women and I want to be better versed, and I want to, I want to be helpful. And so, this first event, I feel like, it's just, I'm just letting out, I'm talking to women, I'm being myself, I'm being a mom, I'm being a woman who has lost, and I think that I'm just natural. Like, I'm just me. I'm raw. Like, I'm not wearing makeup. I'm not doing anything.
Yes.
I'm just me. But I really do want to move into the, being helpful. And yeah, there's so much to it. Like when you go through these this like course, there's so much you have to learn and you look at, and yeah, they do know what they're doing. Like they know
Yes.
what we've all gone through. And a lot of the time they have been through it themselves, which is just
so powerful,
so helpful. Yeah. Like if you've had a counselor who hasn't gone through it, it's not
yeah.
it's not the same. Like, it's great as a support person, if they're a support person.
Absolutely.
Helping you through like maybe they're helping you clean your house and stuff like that. But as a counselor, it can be really tricky because there isn't that connection as much.
Right. Yeah. No, doulas are amazing. So shout out to my doula, Arden, and to all the doulas. Thank you for all you do.
There's doulas, there's coaches, all those things, you don't have to see a counselor per se, or or a therapist per se. Those can also be really helpful because they're, everyday women who have also gone through these things as well. But I mean, therapists are everyday women too. It's just, I think, sometimes, it can get a bit tricky, like if they haven't gone through something in terms of this loss and infertility. But you yourself are a therapist, so
I am. No, I totally agree. I think with eating disorders, so I am very transparent about this. Growing up, I had an eating disorder, and I think that's what makes me a good therapist to my clients, is because like I may not have walked in their shoes, but I've been there. I've been in the trenches. So I think that's why I can, knock on wood, most of the time be helpful. And I would love, and I do have some older adult clients who have experienced infertility and loss, but not as many. That's not like my focus. It just happens to also be a part of their story, because there is so much overlap between infertility and eating disorders, or infertility and loss and eating disorders, and it's just not talked about. That's like a whole thing, but we're working on that. My friend Colleen and I are actually making a presentation about it, so that's cool. But yeah, I just think lived experience is so valuable. I just think especially with loss and infertility, because the ache in your heart, no one knows that except someone who's lived it.
Yeah, no, it's so true, so true. Let me know when you do that talk, because I can link it below, because we like, there are so many connections now that are being made, in the loss community and in this space, in terms of like what causes and what is linked and everything. So it's always really good to like gain as much knowledge as we can and try and help as many people as we can have babies, because that's what they want to do.
Yes, absolutely.
I'm all about the baby making.
Same.
It's funny because we go from like the normal way, natural way, and we were just kind of like, we're like, so we tried, and moving on, I did IVF.
Yes.
Much faster. We're like, yep, because we all know what that bit is.
Yes, totally.
Was it the fun bit, the fun time, and then you start timing things, and it's like, it's not as fun now.
It's not fun anymore. No.
So going back to loss and pregnancy after loss, how are you feeling in yourself now? Like, I know that obviously it's still scary because you're pregnant and you're right near the end, but how are you feeling now, like with your losses and with your loss and being pregnant?
I think I still kind of feel that dialectical pull. Again, I do think it's so almost ironic is like the wrong word, but also ironic, coincidental, God designed, however, you want to view it, that so my due date is April 15th, but I'm hoping to come sooner because I am so ready. But my loss was the 10th, and I just feel like it's almost redeeming in a way that hopefully my daughter will be born safely and soundly soon. I do think towards the end, if I can give like any little tidbit advice for like moms after loss, get off the internet. Get off the internet. I know I am a doom scroller. I can't tell you how many like literally late night videos I have sent to my husband about all the things that can go wrong. And he was like, can you please just go to bed? Like go to bed. He's like, I'm gonna parental lock your phone. Like send help. So like if you can resist, and also the algorithm, if you can kind of trick the algorithm so you don't see those things, that'd be great. But I think I still feel a lot of fear, and I do feel a lot of sadness, but also a lot of excitement and hope. I do feel hopeful that, like I said, someone will get to call me mom, and I can't wait for that day. And I can't wait to the baby smell her little forehead and kiss her and all the things. So I am excited to meet, my daughter, hopefully. And I think I also am sad to not have my other daughter, but I know that I'll find ways, hopefully, to remember her, and that her sister will know her in even little ways.
Yeah, I know something that's helped me is just knowing that if I'd had my 2 losses, if I'd had either one of them, I wouldn't be pregnant with this one and this, this particular child. So
yeah,
that's something that's pulled me a little bit through, because I'm just like, I'm pregnant with this child, and I want to have this child. So yeah, but it's definitely hard. And I was actually due on the 28th of December, that just passed, for my first loss. So I was with you mourning.
Yeah, December was a hard month. It was really rough. It was really rough. But we got through it. We got through it somehow, some way. I think that's something too that I learned from like this whole experience. More so, I think I've always, known this in one way or another, especially doing what I do and having the privilege to hear stories every day as a therapist. But part of, being human is suffering. And, we're going to have these really challenging, difficult moments in life, but they will pass. They will pass, and you will heal from them, and you will grow from them. But no, that doesn't make them any easier. That doesn't make them any more enjoyable or tolerable or any of those things. But we are resilient as creatures, as individuals, as women. We are resilient. We're strong. And sometimes being strong really sucks. But, suffering is part of the human experience, and we'll be okay.
Yeah, so true. And strength looks different for every woman as well. Like, it's something I've noticed,
Absolutely.
and we don't feel strong in the moment, but someone else is looking at you going, wow, you're amazing.
Totally. Yeah, for sure.
So is there anything that you might want to say to anyone who's maybe in the throes of it right now? They're going through maybe infertility, and it's really, it's really rough. Or maybe they're pregnant and they're pregnant after loss, and they're just kind of really, going through what you've just been going through the last, 9 months.
Yeah, totally. So I'd say anyone in the throes of infertility, first of all, my hat is like off to you. And I just send you so much compassion and love, and just all of the positive things in this world, because it is hard, and you are incredibly brave and incredibly strong. There's always hope. And I think I want to encourage you to advocate for yourself. I think sometimes we get so wrapped up in baby. And yes, we want a baby, or we want to be doing all those things, right? But don't forget about taking care of you and advocating for your needs as a patient. because I think that's really important. I think I did that a lot. And I think part of that was why my doctor and I had such a good relationship, was because he was always willing to listen. He didn't always agree, right? And that's okay. But he was always willing to listen. And I never felt like I couldn't respectfully speak my mind. So I think, advocate for yourself. Know that, yes, you want to advocate for that baby, but also your needs matter too. And that taking a break, if that's ever something you feel like you need, is okay. It's okay. That doesn't mean you failed. That doesn't mean you won't get your baby. And also that every family looks different. I think the hardest part about going through infertility, especially IVF, is that it's not always successful. It is a privilege for you and I to sit on the other side and say, we're expecting. So know your odds, know your statistics going into this, know yourself, but know that like families look different in every single way, and that's okay. But it's okay to take breaks if you need to, and to prioritize you. That doesn't mean you won't get your baby. That just means it might not be right now, but we're cheering you on, and we hope you get that baby. But just know that it's okay. And I would say pregnancy after loss moms, buckle up. I wish I had nicer, but no, you're amazing. You're amazing. Find your tribe. I know that is really what did it for me. Find your tribe, hold them so, so tight. And also know that no matter what the outcome, this is a different pregnancy. I think reminding myself of that throughout this time was helpful. Although I wasn't, and I still don't feel 100% confident in even this pregnancy now, although I feel hopeful. Just reminding myself that this is a different pregnancy. So I think remind yourself of that as much as you can, and that your body was made to do this. It was made to do this. So just kind of some compassion and gentleness towards yourself every day will go a really long way.
Yeah, no, I loved what you said. Buckle up. It's so true. So good.
Right?
So good. But yeah, I think, we do need to think about ourselves. And it's funny you saying that, because it's something I've sort of been saying as well. Like we forget ourselves. We get stuck in that headspace of, I want a baby, I'm going to make this baby happen, and then we forget our own health, our own, and I mean, the baby's health is our health in a sense, because, we've got to carry them. So,
yes,
yes.
Yes.
But yeah, no, it's so true. We really do need to care for ourselves as well. Don't beat yourself up if you don't do it in the right way, or the way that people say. Like, just do your best. That's all we can do,
Yeah.
and just, really, really give it a go. Because sometimes we just need to be pampered,
Yeah. Absolutely.
Take that break, go to the spa. I don't know. I've never been to a spa.
No, I don't know. I mean, I've gotten my nails done. I'll count that.
Wow.
Good manicure, pedicure, that goes a long way. Some
I've
Starbucks.
I've had a haircut before. Not in a while though. It's like super long now.
I know mine's long too.
I feel like everyone's like that now post-COVID. We're just like, everyone's just really long hair. They're like, yeah, I still haven't bothered going to the hairdresser. I think
I'll get to it. Yeah, I think being pregnant too, I know I put off like so many little things, like getting my eyes checked. Like, I really need new contacts, but like, I'll get there. Maybe after the baby comes, maybe.
Yeah, I've got some teeth things going on with my like wisdom teeth, and apparently it's really common in pregnancy, and I was just like, I'll check it after the baby's fine.
Later.
My mom's like, no, check it now. You check up. You don't have to do anything. Just like see what's going on. So you've got a plan. I have a plan. I'm having the baby. I want to have the baby first. Make sure everything's fine. I think she's just worried, if something happens, then I'm just like, I'm not going to the dentist. No, you still have to go. There's something wrong.
Totally.
You can't leave wisdom teeth that are going wrong in there.
Yes. Oh.
Oh, it's amazing, really. But I will be praying for you. I'll be praying for your
Thank you.
baby and praying that
Same to
everything is
you.
good and the baby's healthy and breathing and wonderful and screaming because
Yes. Yeah. Yes, a great set of lungs. I'm here for it.
in this space, like I'm always like, please let the baby scream lots, because it's just you need that. You
All
need
the things.
you need
Yes.
that. I my last live pregnancy, my son came out and he was really floppy and didn't scream. And I can tell you it was terrifying,
Oh man, I
terrifying.
bet.
And this was before my loss experiences. So
Yeah.
I was just, yeah. So, if you don't hear a scream, it doesn't necessarily
Don't panic.
mean anything. But at the same time, I am praying for screaming for you so you don't panic in that moment.
Perfect. I can't wait.
So do you have you got a birth plan? Have you done those things? Like
Kind of like I do. That's something I actually did with my doula. She was like so helpful in that because I was like, I don't know. Like I've never given birth, so I don't know. So she was really helpful with that, but really and I think my OBGYN is like finally starting to get it that I was like, my birth plan is that we both walk out of here alive.
yeah.
And like they were just like, okay, like all right. So looking forward to saying that to the labor and delivery nurse. Hopefully she'll get it. But really, like at the end of the day, I don't care what goes down in that room as long as, I leave with my daughter happy and healthy.
Yeah. No, I was talking to a lady the other day and she said the one thing that actually helped her get through the pregnancy after loss was planning, like making a plan for the delivery. And she said, I feel like I should have made a plan for postpartum too. So
Yes.
maybe,
Yes.
I mean, I don't know if that's something for you, but maybe do that, like make a plan for yourself for postpartum, just so you've got like a, looking after yourself thing going on. Because she said like she was so focused on the having, so afterwards she was just like, oh,
now what? Yeah.
and she said like she was obviously after delivery we go through a whole postpartum, our bodies are struggling a little bit, bless our bodies. So she had a bit of a time with that because she didn't make any plans at all, and I don't think any of us do. Like I had 3 kids first, and I did not do any postpartum work with any of them. And my husband's like,
they're fine, but
yeah, they're fine. I'm not. My husband's like, you need to take better care of yourself. You need to do these things. And I'm just like, I'm too tired now. Like,
no, I get it. I do have a lactation consultant lined up. So I'm hoping, and she seemed like really warm. She's like a nurse by trade, and like that's kind of like her side job. So I liked connecting with her. So hopefully, although I'm totally of the mindset like vet is best, but I would like to try. And since I've never done it before, I figured having someone to hold my hand could be helpful.
Yeah, definitely. I know there's some doulas in the loss space as well that do both. So they'll like help you with birth and with the loss as well. So that's definitely something to have a look at as well if you wanted to see talk to someone who's sort of like in that birth space as well. I don't know if your doula's in both, but yeah, I find that really helpful.
I think she does both. Yeah, I think she does do both. Probably. She's amazing.
Just be like, talk to me more. I need the things with babies.
Tell me everything. Yes. No, she's wonderful. She did say, she's like, stuff might come up for you. We can literally meet anytime. And I was like, okay. So
oh, that's wonderful. Well, thank you so much for speaking to me. And I might even link her down below because it's good to have good like contacts and people who are lovely.
She's amazing.
Like all these messages and you were like,
No, I shout her out like anytime I have a chance. I'm always shouting her out because truly, I can't believe I didn't even think of that, but until like after we were talking about, she was a game changer for sure.
Yeah. Well, maybe I'll just like private message her and be like, you're amazing. Yes.
She loves doing things like this. So she would love to talk to you. She personally has losses, and I'm sure, and living children. So lots of hope there.
Yeah, hope is so important, guys. Hope. Okay. Just use us as hope if you don't have any yourself, but you've got it there somewhere. There's like a glimmer somewhere. That's why you're still going.
Yes, we believe in you.
Exactly. Thank you so much, and enjoy the rest of your day.
Yeah.
Thank you. And yeah, I'll be praying.
Yes, me too.
Bye.
Bye.
Please note that all speakers, including experts and professionals, express information, views, and opinions that should not be used to diagnose, treat, cure, or prevent any medical conditions. If you have a medical issue, please consult a qualified professional. Speakers voice their own views, opinions, and conclusions, and they may not reflect the views, opinions, and conclusions of other speakers. Ella Rose, The Joy of Sunflowers, and its sponsors may not endorse all or any of the views, opinions, or conclusions expressed.